Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the programme tonight, as India crosses 1 lakh daily cases of COVID, we're joined by Dr. Randeep Guleria, Dr. T.P. Lahane and Dr. Sridhar Reddy, three of the finest medical minds in this country, as we ask a basic question. Is it time for a lockdown in India's worst hit areas? Also on the show tonight, the new Rafale scandal, or is it one at all? It depends on who you ask. A French media house says 1 million euros were paid to make 50 models of Rafale fighters and that this money was transferred to a well-known Indian arms dealer who's been investigated by the CBI and the Enforcement Directorate. All of this has triggered a war of words between the BJP and the Congress. We'll be joined by the French journalist who broke the story, in addition to our political face-off. But first, the big story. India now has topped the world daily average of cases in COVID globally. Although totally India is still third, 12.5 million, that's just behind Brazil's 12.9 million total cases. With 1,03,558 fresh COVID cases, India has seen what I was talking about, the biggest ever daily surge. This is the highest globally in the last 24 hours. 478 deaths in the last 24 hours, exceeded only by Brazil, which saw over 1,200 deaths in that country. So India has reached this grim milestone, 1 lakh daily cases for the first time since the 17th of September last year. On the 17th of September, it was 97,894, and now it's crossed that. It's gone to 1,03,558. A lot of people would suggest that we are in deep trouble in India, and that unless we move beyond talking about how things need to improve now, we are in deep, deep trouble. Well, joining us now, Dr. Randeep Guleria, a key part of the COVID task force in this country and the director of AIMS, Dr. T.P. Lahane, director of the Medical Education and Research in Maharashtra, also joined by Dr. K. Srinath Reddy, the president of the Public Health Foundation. Dr. Guleria, let me come to you first. Is it time for large parts of India which have been affected to go into lockdown?
So a large part of India have been affected, and the situation is quite worrying because the rate of rise in the number of cases as compared to last time has been very steep, and we've reached the 1 lakh mark in a very short period of time. And therefore there is a need to do some aggressive things, and we need to really have a strategy in place. If we can't have a complete lockdown, at least we need to have containment zones and make sure that we are able to contain the infection from spreading from one area to the other. These containment zones should be almost like a mini lockdown so that people from there cannot go out, and a lot of testing, tracking, treating and isolation should be done in these areas, and everyone who is in these areas, especially the close contact, need to be tested aggressively. We really need to go back to our policy that we were following 6-7 months ago in terms of surveillance, in terms of testing, in terms of maintaining containment zones and trying to really contain the infection from spreading to other areas, and of course aggressively push for COVID appropriate behavior.
Dr. Guleria, lockdown has become a bad word, a bad phrase, and perhaps rightly so, because it encompasses a great deal of hardship for people. But if all of our goals, doctors, professionals, is to save lives at this stage, isn't that something we should be saying? India, in large parts, worst affected, needs a lockdown. I mean, would you agree that we need to be saying that?
So in regional areas where we're seeing a huge number of cases, we will have to look at a strategy which could also include a lockdown. I do agree with that, but it's not something that we need to look at a national level.
Okay.
We will need to identify areas where there are hotspots, and that's like what I said, that you could have containment zones and lockdown areas in those areas, because we have a differential. We have areas which are currently hotspots, but we have areas which are not hotspots, and
Correct.
We want to make sure that the hotspots don't move from where they are right now, and sort of other areas start becoming hotspots. So that type of strategy needs to be developed, which has to be area specific, it has to be region specific, it has to be also urban and rural specific. Urban area challenges are different, rural area challenges are different, metropolitan city challenges are different. So every area will have to develop a strategy which is suitable for that area, but that has to be done very, very aggressively considering the number of cases that we're seeing right now.
Dr. Lahane, since we spoke last, is there finally some sort of scientific clarity on the nature of the mutant that we are dealing with?
Basically, what mutant we are dealing for that, we are doing the mapping of the total state. We are sending for 25 sample each district every week. And once we map it after, I think within a month, we will come to know that it is a mutation that has troubled us. Secondly, as you see, the number is in Maharashtra is increasing. So what we are doing is the common places, that is like a hotel, cinema, or the chowpatty, all those things we are closed down. Also curfew in the evening. And on Friday, Saturday, Sunday, there will be a lockdown all over the state. And also in the hot spots, we are also imposing the lockdown. So we are trying that the people should know, message should go, and another thing is they should use the mask. So today, whatever number, as the Guleria sir said rightly, that the number is increasing, we are at highest, that is 1,03,000 cases every day. That means we have attained. In the last wave, it was 25,000 on the 25th of September, and now in Maharashtra, but now it has gone to 57,000 within a month time. It means it is a very fast. It means that strain is definitely different than the previous strain. That is what we are thinking.
Dr. Guleria, it seems that this strain has increased transmissibility. Do we know if the infection lasts as long based on the numbers we are seeing? Is it as dangerous? Do we have anything further on age? We were talking last time on how younger people are more vulnerable or appear to be more vulnerable.
So initially the infection is much more in the younger age group, but I think that is more related to the fact that they travel a lot, there's more mixing, there's less COVID appropriate behavior in them. But what we're seeing subsequently is that they would carry the infection to their house, and the elderly in the house will get the infection. And now if you look at various states which had a spurt in the beginning, they are now seeing increasing number of admissions and more hospitalization. That means now we're seeing more sick patients who are requiring hospital care. The concern that I have is as these numbers increase, and unless we take aggressive action, it will cause more and more strain on the healthcare system. If we allow the virus to spread like this, the numbers will increase and the percentage of people who would require hospitalization will also increase in a proportional manner. And therefore you would have need more ICU beds, need more oxygen points. And this is going to be a huge challenge because currently we are facing a different situation than what we were facing 6-7 months ago. And that is that because of the decrease in number of cases in February, a lot of non-COVID work has also started. And now we have a lot of traffic, we have a lot of roadside accidents also, trauma is also there. So you are now having hospitals which are having to manage a lot of non-COVID work with a huge increase in COVID work also, which is going up substantially. Your beds, your human resources are the same. You're not suddenly overnight going to double your beds or have double the residents or double the faculty. And that is why we need to work more in decreasing the number of cases as much as we can. Otherwise, it will cause a huge strain on the healthcare system, which is already quite overburdened.
Dr. Guleria, do you have a number on the increased transmissibility of this strain? What percentage more transmissible in India?
So I don't think that data is there in terms of exact scientific data. There are studies which are being done and which are being looking at the number of cases being reported from various areas and the strain that are being seen. But if we just look at it in terms of the variants and the rate of spread as compared to what it was in September, it is definitely much more transmissible. And if it's the UK variant, the data from UK suggested that it was almost 30 to 60 from 30% to 60% more. The spread was more as compared to what it was as far as the previous variant was concerned.
Dr. Reddy, there's been a Lancet study which was done last week where the reports seem to suggest that in asymptomatic cases of the UK strain, the effectiveness of AstraZeneca was lower, considerably lower. However, in symptomatic cases of COVID of that strain in the United Kingdom, it still offered very good protection. But the fact that there could be asymptomatic cases who would be very vulnerable even now despite the vaccine, which is, is that something we should be worried or concerned about?
Yes, certainly we should be concerned if there are infections happening, though we know that the primary purpose of the vaccine is to prevent severe infection and deaths. However, recent evidence suggests that actually transmission rates are also being affected by vaccination, and that we have after immunization programs have started in different parts of the world. And we have evidence, for example, from the Pfizer-BioNTech vaccine that's being used extensively in Israel, that the transmission rates have remarkably come down as well, apart from severe infection and deaths. So we do have to look for even that additional benefit. But the biggest problem here is that if an asymptomatic or mildly symptomatic person who doesn't report for testing continues to discharge the virus, then we are going to have problems in terms of transmission. And that's why I'm emphasizing, irrespective of the nature of the variant, and we have to make sure that everybody is wearing masks and is observing the kind of public health precautions of keeping a physical distancing and avoiding overcrowded events, because there is likely to be increased transmission because of people who have not even been tested or who may not be aware that they are infected. I agree with Dr. Guleria, we do need to take stringent action to limit transmission in really hot spots. But across India, unless we instill that discipline for some months to come, that we are going to have masks and we are going to prevent overcrowded events, we are going to see this continuing challenge. And as I said, we'll have a seesaw motion of lockdowns and laxity, which is something that we must avoid at all costs.
It's something we cannot afford at all. I'd like to thank you very much, all of you very much for joining us. Night curfew across the state in Maharashtra from 8 p.m. to 7 a.m. Prohibitory orders all day. There's a weekend curfew as well, only essential services during the weekend. Malls, bars, restaurants, theatres to stay shut. Food delivery allowed only during the day. Government offices to function with 50% staff. These are important steps. This is virtually a lockdown in many senses. Will moves like this actually bring down Maharashtra's number? Do they need to be replicated in some of our other badly affected cities, even smaller cities? I'd like to thank you all very much for joining us. The new Rafale scandal, or is it one at all? It really depends on who you ask. Mediapart, a well-known French investigative house, says that 1 million euros were paid to make 50 models of Rafale jets, and that this money was transferred to a well-known Indian arms dealer who runs a defense company in India, which doesn't really make models, they do other work, but it was this arms dealer's company which was given this particular contract. The arms dealer in question has been investigated by the CBI and the Enforcement Directorate in connection with the Augusta-Westland VVIP chopper deal. Should more have been done in France to actually look at the contours of this particular deal? Is this a scam at all? It certainly triggered a war between the BJP and Congress, perhaps expectedly, and we'll get to a political face-off in the next few minutes. But first, we're joined by Yann Philippin, the investigative journalist with Mediapart in France, who has broken this story. Joining us now, Yann Philippin is a journalist with Mediapart, and it's very much his story. Thanks very much, Yann, for being with us. The bottom line,
for your invitation.
You used the word middleman. In India, where does this middleman lead to?
I'm sorry, this middleman, so Mr. Sushen Gupta, is quite famous in India because, as you know, he has been placed under formal investigation in your country, in India, by the Enforcement Directorate in another arms deal, which is the very famous Augusta-Westland VVIP Choppergate, as you call it. And so that's what makes, that's one of the reasons making this payment suspicious. Is it why this middleman, which is quite famous for helping many foreign aerospace companies in India, why did he receive 1 million euros for the alleged sales of plane models just after the Rafale deal was signed?
So, Yann, I'm just trying to understand the middleman, presuming that he was paid this 1 million euros or a part of that, whatever it may be. Is it your allegation or your report that this money was used to grease the palms or to bribe what, political leaders? Who are you talking about? Who was it targeted at?
I don't know. You know, Mediapart is a very respected investigative media,
yes.
and we are proud to write only what we can prove. And the problem in this case is that we know that there's been these very strange and suspicious payments to this middleman under cover of buying plane models. And the real problem here is that it has not been investigated. You know, I'm just a reporter. I don't have the power to investigate this far and to follow all the money trail. And what is not normal in this case is that the French anti-corruption agency knew about this. So there should have been a formal investigation to investigate this to the bottom, but the information has not even been reported to the French prosecutors.
We'll talk about this information because it's interesting, and it's, you know, I mean, there are lots of strange things there. But I just want to understand this basic point. Mediapart believes, you believe, that this was a suspicious transaction involving a middleman in India, but the purpose of this suspicious transaction, right, beyond the models, you have not been able to identify.
Yes, we didn't. What we have very clearly is that this is a suspicious payments for two reasons. First reason, as I already said, because this middleman is already prosecuted in another defense deal in India. And the second thing that we didn't talk about yet is that, you know, when these inspectors from the French anti-corruption agency discovered this payment, they asked Dassault about it, you know, what is it? And especially this payment was written in Dassault's accounts as a gift to customers.
Yes.
So, you know, which is very strange for a plane model of this price, you know, so expensive. And what we learned is that Dassault was not able to provide any element of proof showing that these models have been manufactured or have been delivered, not even a picture of these models. So, you know, beyond that, all that we can say is that, yes, it is suspicious. We don't have proof yet that there is a direct relationship with the Rafale deal.
Right.
But what we know is that, what we think is that given this, this information should have been reported to French prosecutors in order to try to discover the truth.
Yeah. So, Jan, since, you know, we spoke earlier on, or we've been in touch, you know, I did a little bit of asking around, and what I've learned is that there is a model of the Rafale, apparently one of these models, outside the residence of the air chief here in New Delhi. There's one apparently at the Gwalior Air Force Base, which is the Mirage 2000 Air Force Base. I believe there'll be a couple which will be sent to Hashimara, which is the second Rafale squadron, which is being set up. Apparently one at the Western Air Command over here in New Delhi. And the point being made is that they have been built. It's not as if it's a figment of someone's imagination. They're actually there. A few of them haven't yet been delivered, but they've been made. But I think the point that remains strange is, why should each model cost 20,000 euros? I don't get that.
I don't get that either. And, you know, I also spotted some of these models. There's even an official picture released by Dassault Aviation that you can find on their website in the, you know, press section of their, you know, media resources section of their website. So there's one of these models which is in front of one of the Dassault establishments in India that we published in our story. But my problem is that we don't know. So there's this problem of the price that you pointed out, and that's very strange. And also there's the problem that Dassault refused to confirm to me that these are the same models. You know, the models that you spotted and the models that I spotted in India. Are they the same models that were ordered to this Indian company? We don't know.
And final question, when you did go to the French prosecutor and said, look, can you tell me why this point was not highlighted? What did the French prosecutor, I beg your pardon, the French anti-corruption investigator,
right?
What did the French anti-corruption investigator tell you?
No comment. Absolutely no comment. They
And
say
there
we
was
refuse to comment.
was no explanation of why no comment.
No explanation. All that they told me is that there is professional secrecy, that they are bound by French law to professional secrecy for these audits, and so that they were not at liberty to comment the results of these audits.
Well, joining us now, Wing Commander Anuma Acharya, a security analyst and spokesperson of the Congress Party. We're also joined by Deshratan Nigam, a political analyst. Thanks both very much for being with us. Wing Commander Acharya, you heard us speaking to the journalist who actually wrote this particular report. But ma'am, they don't have evidence on where this alleged money trail, if there is a money trail, leads to. Quite clearly says, we are not reporting what we don't know. And so to specific questions on, was there a kickback to anybody? Did this help facilitate a part of that deal? Says, we don't know this, so we haven't reported that. That's not what we are looking at. This being the case, do you believe that there needs to be an investigation here in India to look at where the funds of this company went? Should this company be audited for this deal?
Vishnu, all I have to say is that whatever has been revealed, it has been revealed from the audit books, audit of accounts of that particular company, and they have found gift to client. That was the thing which was written and which has been highlighted. All I have to say is, besides this, as a logistics officer who used to deal with not with the capital procurement but the revenue procurement, I happened to go through this CAG report and I have found couple of things which were objectionable in that deal. One was that it is an intergovernment deal, but it has not been disclosed what is the saving to us, because in any intergovernment deal, the government has to pay lesser amount because the product is already established in the other country and it is already in use. So we
no, but Wing Commander,
we
are not talking about the old Rafale deal. There's been a Supreme Court judgment on that.
No,
and if you want to talk about the CAG report, there are lots of parts of the CAG report, linking to UPA Times, which we can also talk about. I'm only asking you about this investigation, ma'am. And I'm trying to understand whether you believe the accounts of this Indian company need to be audited, because it seems strange that a model would cost 20,000 euros. Yes or no?
We can definitely investigate that, because it is concerning a country and it is concerning another defense deal, and the deal has a lot of deficiencies. Already when we have gone into it, we have gone without a warranty bank guarantee clause. What is a safeguard with us? Tomorrow if a Rafale doesn't function properly.
The guarantee is that these aircraft are being delivered broadly on schedule, that there has not been any problem in the delivery schedule at all. And secondly, there is French government oversight. There is French government oversight on every aspect of the financial receipt of payments from India, right? There are meetings held every 3 months to see whether the funds which have been received by India go towards the actual acquisition of this aircraft. This has been a flawless acquisition process so far. But ma'am, let's talk about what we know so far. This is all old hat, but just a moment, let me bring in Deshratan Nigam at this particular stage. Sir, there are still some important questions that need to be asked. Yes, this particular deal between this India-based company and its owner happened after the Rafale deal was signed, but is it not strange that 20,000 euros was spent per model which was built? Why would any company do that? Therefore, the allegation that it's strange, it seems founded. Wouldn't you agree? Shouldn't that be looked at?
I think I'll give you a very common sense reply, and obviously through legal perspective as well. The fact remains that it was a government to government deal, and all payment receipts, as you rightly pointed out, there is a French government oversight and they are looking after the deal so that the schedule is maintained, which has been maintained till now. Now, whether it can be audited in India? No, certainly not, because this is a separate contract between two companies, and it is a question of non-performance of a contract, and therefore it boils down between a private dispute between two parties, private parties, and Government of India has nothing to do with it. And to stretch it, nobody has any evidence, mere suspicion. And I'm sure if I was in the French, anti-corruption bureau, I would have referred the matter, because there is no evidence, no proof, mere suspicion. So therefore, it has rightly not been referred for prosecution.
No, but
sir,
but
as a lawyer,
but Mr. Nigam, sir, is it not problematic if you are an auditor, and this is what Mediapart is actually arguing, that how is it that a deal where €500,000 has been paid as a 50% advance for the procurement of 50 models at a cost of €20,000, how can any company justify that? That's the job of an auditor, to raise questions. How is it not a valid question?
No, not for Indian audit. If it is under French laws, they can as well do it. Let me tell you, this is a contract between two private parties, and if one party is not performing or overcharging, this is between the two parties. Indian government has nothing to do with it. You cannot link this contract with the Rafale contract.
Should an inquiry not be ordered in India? This is a case which went to the Supreme Court twice. There's been so much interest in this, so many allegations on this, and therefore in the interest of transparency, even if this happened after the deal, should there not be an inquiry on how a company in India was making €20,000 euros for a model of a plane?
Vishnu, let us be very, very clear what government of India has to do with it. Mere possibilities, even the French government has not referred it to prosecution. They themselves, it is well within their jurisdiction. If their audit report is pointing it out, they have not found it fit to be referred because of the lack of evidence or anything. Mere possibilities does not lead to any prosecution. Please remember that. And Indian government has nothing to do with it. It's a separate government between two private parties. If they have a problem, they can take each other to the court.
All right, fair enough, fair enough. I'd like to thank you both very much for joining us on this. There's a lot more which is likely to emerge, including documents which Mediapart will be coming out with in the next couple of days. Is this new Rafale controversy the real deal?